All right, we're recording.
All right.
Dr. Pete, what do you go by, bro?
Pete
My
works,
brother?
man. Pete works. Yes, sir.
Yeah, but you'll take it the other... Bro, you're a doctor, bro.
That's true. That's true. But it's okay.
You've earned it,
We're
man.
colleagues, man. We're colleagues.
I'm a humble worm, bro.
Hey, it's okay. We're all growing.
My man, thank you so much for coming out.
Absolutely.
You mentioned that you love doing podcasts.
I do.
And you have done a show with... Remind me again who it was?
Yeah, Dr. Smits from Loma Linda. Shout out to Dr. Smits.
Shout outs. How's it going, man? When did you decide to do that?
So, I mean, with any business, the marketing is a lifeline of any business, right? And so I wanted to always produce content that's more educational based. And so it's called education-based marketing. And so I reached out to him. We got connected somehow. I forgot exactly how, but I really wanted to almost flood my social media page, my work one, with education. You know, you look at all the other Instagrammers, like the Rehab guys, or right, and so just any of those guys have amazing reels or educational videos, and so I didn't want to do exactly that, but I wanted to interview people like medical doctors and have a series called Ask the Doctor, because everyone has questions to ask the doctor, and they can ask us too, because we're doctors as well in physical therapy. But I wanted a medical doctor or someone more specialized. And so somehow he came into kind of my connections, and I reached out to him and he was like, yeah, sure. I'm like, all right, cool.
So you didn't know him before? No.
I just met him we got connected through maybe Josh, or I forgot someone.
Yeah.
And then, he was super down, and he just started at Loma Linda. So maybe he wanted to also start marketing for himself, get his name out there, and it just kind of worked out. And so we've been friends and just, co-podcasters for a while now.
Shout outs, man.
Yeah, for sure.
Somehow I'll figure out how to put a link on like how to find him and find your stuff too.
Absolutely. Yeah. At the end of every episode, I put his office, phone number and whatnot.
Right. And you too, man. We got to get you too.
Hey, thanks, man. Appreciate it.
You mentioned just kind of like that flooding your educational business.
Yeah. Yeah. Education-based marketing.
Yeah. Marketing. Sorry.
Mm-hmm. Yeah, that's okay. Part of the business.
But if like for someone who doesn't know you, you direct and run your own clinic. Yeah.
So I've been practicing now as a physical therapist for 12 years, graduate from Loma Linda.
Shout outs again.
That's right.
This is going to be full of shout outs.
Full of shout outs. The shout out episode. And so, after PT school, I knew I wanted to do orthopedics and sports. I was always the injured athlete, very classic story of a PT who played sports, got injured, got rehabbed. I didn't get rehabbed by any physical therapist. I just knew that I was always injured. So as my junior year in college, long story short, a buddy of mine told me about PT. I was actually pre-med at the time. And so I wanted to pursue a career in medicine. But I think the medical school route was a little intimidating for me personally. And then so, my buddy told me about PT. So I did my hours, and I just fell in love with it. It was a good mix of anatomy, education, interaction with people. And so I applied and I got in. And so that was 12 years ago. I finished PT school. I knew I wanted to do, again, sports and ortho, but I didn't know what direction I wanted to go at the time. The only thing I did know was one of our professors at Loma Linda, his name was Sculpan. I knew that I wanted to learn under him. He had this way of interacting with people. He had this way of clinically helping people the fastest or the most efficient way. And so I knew I wanted to do a residency program, and lo and behold, he started one at Loma Linda. So after PT school, 2010, I applied to Loma Linda's orthopedic residency program, and I got in 2012. And yeah, absolutely. And so that year spring shot me in my career, because after that, well, actually halfway through that, Sculpan was like, do you want to do a sports fellowship? Because I know you like sports. I'm like, I do like sports, but I have no idea what a sports fellowship was. And so he's like, well, it's this and this and this. He's like, just apply. I'm like, all right, I'm probably not going to get in because, I don't really have that much background or, whatnot. But I think he helped me get in for some reason, because I bombed my interview. I was so
It's
nervous.
who you know.
Apparently, that's a life lesson right there. Make connections, guys.
Make connections
Yeah.
right now.
Anyways, right. So, anyways, he I believe helped get me in. I think there were certain people that also orchestrated that. But I did 2 more years. So I did 1 year of sports fellowship training, and then Skullpan, the same mentor, said, "Hey, do you want to do a lower quarter biomechanical fellowship?"
Oh
I'm
my
like,
goodness.
What is that? It just steamrolled.
Yeah.
Long story short, after PT school, I knew I was passionate for the profession. I just want to learn more and help my patients better. And so I did 3 years of training in a sense. And then my dad was like, "When are you going to start working?"
For real, it's like,
typical
okay,
parent, right?
It's time to start.
It's time to start. Exactly. And so he said, "Well, you've learned a lot of information. Maybe you should package it in a business or provide it as a service to someone." And at the time, I was working at a hospital-based system, and I was finding restrictions in the way I wanted to practice after I learned all these things. And so
I'm gonna just take a bookmark of that.
Go ahead.
Bookmark.
And so, after that was 2014. I was finishing up my last fellowship. And so I decided to create a business plan. I decided to look at budget, look at costs for starting a practice. And my dad was able to help me financially with, bank loans and whatnot. And so 2015, I saw my first client, March 2015.
Ooh, crazy.
And I had one client.
Do you still remember that person?
Oh, totally. We're still friends to this day.
Heck yeah, man.
Yeah. And so
it's like all that training, all the hours, all the extra continuing ed, so to speak.
Yeah.
And then you finally open it up.
Yeah.
But all along the way, did you know what it was going to be like to run a business?
No.
Because it's kind of like a business. Well, it is a business.
It is. It's straight up.
But it's like the business in terms of what you've learned. But no one really teaches you the business side of
you
PT.
Don't. In school, it's probably better now, but back then there was not a lot of business related classes. I do remember maybe a segment like 1 quarter where they talked about business development, like private practice, but
Just super
this is short, condensed, right?
Yeah.
And so thankfully, again, my dad was in the business world. He knew ins and outs of how to start one, how to run one. And so he was pretty much my business mentor. And after that, I had to really read a lot of books, go on YouTube, talk to people. I even signed up for certain courses to help me run a cash-based physical therapy practice. And it took me probably up to this point. I mean, it's been about almost 7 years. I think it took me about 5 years, 3 to 5 years to really understand how a PT practice works and how to combine the cash-based aspect of things, but also to incorporate the insurance model as well. And so it's going to be an everyday, learning process moving forward. But I think at this point in my career, I have a pretty good idea of how to run it. Now it's to execute it to make it more efficient.
Yeah.
So it's the fun part for me. I love growing things. So
yeah, for sure. You're a student of the game.
That's right.
My dog.
That's right. Always growing.
Dang, man.
Yeah.
Congrats. Well, I've been to the clinic a couple times. Every time I go in there, it's like something new, something fun.
Yes. And that's the whole premise behind it. The whole premise, obviously, the first step is to help active people. And to do that is to have technology and to leverage technology to help us heal faster, get back to our sport or hobbies faster, and to have the most current information to help people faster as well. And so all those things are merged together to provide, hopefully, the best care that we can for the active person. And that's my passion.
Yeah, heck yeah, man.
Yeah.
I just, taking a step back, there are a lot of different professions that deal with movement, kind of injury, and the big word, bro, pain. Okay, so just like, as an example, to give people some context, there's the chiropractors where we kind of overlap with manipulations, and there's there's a couple things that they use that we use also, vice versa.
Absolutely.
And then you have the athletic trainers, which is kind of a mixed bag, because I know some athletic trainers who are just they could run circles around me all day.
Oh, absolutely.
You know what I mean?
They got some real good ones out there.
And then you just have some independent people who kind of just, they have a problem. They would just really want to know what happens. Like they have knee pain.
Yeah.
They just keep on learning.
Yeah.
Now you have all these people. And the fun one is like when you put them on social media, you have like, oh, back pain, try this.
Right.
So what I'm trying to say is you've had such a big focus on providing people with like well-researched technology and like best practice, so to speak.
Mm-hmm.
But then you have like you open the mixed bag of social media.
Totally.
How do you feel about seeing information there? How do you kind of go about like sifting through what's good and what's bad?
Yeah, so this has definitely been a journey for me as far as how do I, number one, react to these certain social media posts. Number two, what is the differentiating factor for myself and all these other providers? So what I think was a more light bulb moment for me and a reframing moment was when I decided to reframe the way I thought about these things. And what it changed to was these people, hopefully, are trying to help other people. So we're all on the same team.
Yeah.
We're all trying to help people through social media.
The goal's the same.
The goal is the same. And who knows what their underlying intentions are. Some people have their own kind of agendas. But I choose to believe that we're all, these people online.
Benefit of the doubt.
Benefit of the doubt. Give them chiropractors, massage therapists, other physical therapists, athletic trainers, personal trainers, all these disciplines that we kind of are all overlapped into. That first step for me was just understanding, hey, I believe they're all trying to help people. So don't get discouraged. Don't be angry. Just take it with a grain of salt. Learn from what they're doing and kind of go from there. And so once that started, I started to also understand who I was as a PT. So we have to understand what we do and what makes us a little bit different than the next person. Yes, we're all trying to address pain, maybe. We're all trying to address the movement problems. And there's a lot of biomechanical specialists out there, right?
The way you look at how it gets on better. Okay.
Exactly. There's so many angles, so many ways to skin a cat in a sense. And so for me personally, I took the angle of technology and movement and diagnostics. And so as I've created this persona or this business model or this approach in a sense, not necessarily me creating it, but just kind of taking on that approach. It seems to fit well with me, my passions. They coincide with my hobbies. They coincide with the way I think, very data-driven, very, very more logic-based. And so...
It sounds like a good fit.
Right, exactly. And so everything just kind of rolled itself into this approach, and it seems to be working. So long story short, as I've fine-tuned this hybrid approach of movement, technology, I've now been able to understand, okay, chiropractors are great at what they do. There's obviously good and bad in any profession. There's good PTs, bad PTs. I try to sift between the lines and see what is their intent with their message. And so chiropractors, I think they're great at manipulation. A lot of them, that's their specialty. A lot of times they're great with relieving pain very quickly. They have technologies as well and modalities that are built to get rid of pain, like deep tissue laser therapy. I have that in my clinic, but I learned that from a chiropractor.
Okay.
Actually. And so massage therapy, they're all about getting more circulation, relaxation, getting more flexible, right? And so I think if you delineate what their intentions are, chiropractics are trying to do this, massage therapy is trying to do this, personal trainers are trying to do this, PTs, hopefully we still have a little sliver of the pie, so to speak. And so once you master that, once you understand that, just make your voice be heard in that. Don't try to tap into other people. Just choose a specialty that you like and just grow that. Whether you maybe like pediatrics, just do that. It's all about niche marketing now.
Yeah.
And so I guess that was a long-winded way of kind of answering your question, but I think there's a lot of content out there, a lot of good content, a lot of bad content. But understanding, number one, the point is to help, hopefully get rid of, it's to be a solution to a problem, right? That's the premise of any business. You're trying to solve a problem. And as to how you do it, it's up to you. And you kind of have to decide from that, you know?
Yeah.
So, yeah.
Dang, I like it. I like it. This is not going to sound as polished as your answer, but when I think about it, I think about like MMA, you know? It's like, how can you win a fight?
Right.
I'm a boxer. Okay, yeah, you can win a fight as a boxer. Oh, I'm a kickboxer. Okay, add the feet. I do jujitsu, or I'm a wrestler.
Right.
It's like, whoa, there's a lot of different ways you can, and then you mix it all together. It's like you still have to fight, or you still have to, you know,
get the job done.
Yeah. So it's like, how do you want to get there? How do you want to win your fights?
Right. And each person has their specialty.
Yeah,
right?
Exactly. So
Conor McGregor was trying to be a boxer.
Yeah.
He didn't have any ground game.
But he made money, though. Shout out to Floyd.
There we go. Another shout out.
No, but yeah, that's and then if you, just because you're a boxer doesn't mean like you could be like top tier, top of the food chain, or you could be just a beginner.
Absolutely.
So it's just like kind of the same with, I would say that's the same with PTs.
Absolutely.
I would say school, and this is, I think this is just my opinion, but school kind of just prepares you like enough to have basic knowledge, pass the test. Was it the same for you that, well, never mind, you're a little different because you did the continuing eds.
Right.
But for me, I felt like I learned so much more outside of school.
Yes.
And you were actually part of a lot of the school, like associate professor.
So I'm a contract instructor now. So I teach one class at Loma Linda.
Congrats, my man.
And so thank you. Yeah, I appreciate that. It's been fun. It's been quite a bit of years now. I think I started when I was a resident, 2012. I helped out as a resident, and then I took a little break and resumed it, about 3-4 years ago now. And it's been fun. It's the last class, one of the last classes in spring quarter before the students at Loma Linda go into the clinic. And so I get to help shape their minds as to how to think clinically, how to visualize mechanics, and how to apply it and help patients. And so I would agree with what you said earlier. School is amazing. You have to go through it. You have to learn the black and white nature of our profession.
Just get a good foundation.
And you have to pass boards, and you have to pass the law exam.
Or you have to get lucky.
Okay, sure. Yeah. A, B, B, A.
Yeah, just like too many C's. I had to go A
That's
again.
right. It's off pattern. Yeah. And so, but afterwards, you definitely learn a lot more because the reason why is I think it opens up, once you enter the door of the field, that's when it's like a huge playing ground. There's so many, the field is so wide. You can go left, you can go right, you can go up, you can go down. You can learn as much as you want, or you don't have to learn. You can just coast. And so I think for me personally, I've always been the type to not take things for granted. And so I've always wanted to grow and learn because I know life is short. It can be taken away at any time. As a young person growing up in America here, I didn't have a lot. And so I try to be grateful for what things I do have currently. And so, PT school, again, going back to that, is definitely a stepping stone to learning more. And I think as you find your way, if someone's maybe listening to this, trying to find their way as a young medical provider or a young physical therapist, I think it's trying to take inventory of your personality, take inventory of what you're passionate about. Like for you, this is your side passion project, right?
It's my little baby.
That's right. It's still growing. And so things like that, just, I know you're restricted with loans. I know you're restricted with family. If, let's say you have a family, you got to pay the mortgage. There's bills. I totally get that. But there's always ways to make money. And that could be a whole nother episode as far as like personal finance for a young medical professional. I'm not an expert at that, but I do know just a few things that's helped me. And so as you kind of take inventory of your values, your passions, and just how your life is in trajectory, you can choose. You can choose the type of person you want to be, let's say 5-10 years down the road. You know, the big thing for me right now is habits. And I've read the book Atomic Habits, right? And The Power of Habits by Charles Duhigg. So there's these 2 books that I'm currently going through The Power of Habit right now. And it has a lot more stories, and I love stories. So I'm really like latched into this book right now.
You get invested.
Invested, totally. And so what I've learned, and I wish I had told my younger self, this is start doing the small things really well when you were younger. Whether that's finance, whether that's even starting to learn, whether that's, you know, even going to work at a specific time. Just these habits, these life skills that will turn into habits are going to set you off for success. You know, in my 20s, I was making money, you know, making some money, but working hard for the money. Yeah. And so I felt like I almost squandered my money, and I wish I had saved up more. And so if I had to tell someone in their first 5 years,
a little bit more disciplined with that.
Yes. And honestly, I know this is kind of going towards the finance route here, but budgeting, I know everyone hates budgeting, but just having a general budget is going to be super helpful.
Yeah.
You know, and so anyways, going back to habits, personal finance, just life skills, set yourself up for success now, and in your future self will definitely thank you.
Yeah, for sure, man.
Yeah.
I love that. I know that how you achieved your growth in PT was through the residency program, and I'm sure they gave you a good foundation and baseline of how to grow or how to think, and they just gave you like more tools, so to speak.
Absolutely.
In your tool bag.
Yeah.
What can you say about someone who doesn't want to do that route, other than being really disciplined and coming up with a plan to see yourself where you want to be in the future in terms of a PT?
Sure.
How can they get skills, man? How can they get the crossover?
How do you get level up?
Bro, yeah. How do you level up, man?
Get like Steph Curry?
Because a lot of times what I see too is people can get burned out because of so many things. One of them being chronic pain. I hope to talk to you about that in a bit. But you can have, as a clinician, and this might be in multiple health professions, but you can have the same experience year after year, you know, and, you know, decade after decade, or however long you work. And you can spin the wheel and not have that much growth. What would you suggest other than being super responsible and being intentional?
Sure.
Because that takes work, but what else? Like, can I pick up a book? Do you like somebody that do you like a specific continuing ed?
Yeah. I think there's many angles, there's many options. And so it really does depend on your personality type. It really does depend on how much time you have and how much can you sacrifice at the time. And so when people ask me, hey, should I do a residency program? I always ask them and let them know, hey, like, how's your life situation right now? What's the next year or two? Financially, relationally, how you're emotionally feeling too. Maybe you're getting burnt out, you know, and so you have to assess that. And let's say residency is not for you, right? Like you said. And so how do you level up in the PT game without going through official training, right? In a sense. And so, I mean, it's kind of like you're a basketball player, like you can go pay a skills trainer, right? You know, $40 to $100 an hour. Like, hey, teach me how to dribble, you know? So that's like the official way of doing it. Yeah. But you could also definitely go on YouTube, go subscribe to a basketball trainer and go practice handles, you know, dribble too much or something like that, you know, just keep, I think this is handle.
Oh, shit, this guy has the gloves now.
Too much. Yeah, right, that's right. Yeah, that's right. You know, and so you can do that. So you can kind of like do your own research, go on YouTube, go on, you know, social media, and go follow people that you feel like have gotten there, have almost arrived.
Okay.
And listen to them.
Find the guys that you want to be.
Yes, exactly. And so again, it does take work to get there.
I was afraid you're going to say that, man. I was like, I just wanted to have that fast food microwave.
That's right.
I'm a beast now.
Well, we have to go to the Matrix. Plug yourself in.
It's coming. It's coming.
I know, right? And so, yeah. So there's a lot of books, a lot of content out there, social media content that you can definitely follow. And then just pick one skill you want to get better at, maybe even once a month or maybe even once a year.
Yeah.
Maybe use New Year's Day is coming up. Use that as like a checkpoint. And so that's what I do. Every year, I even ask my staff every year. I'm like, hey, every quarter actually I ask them that because I love just having a goal and working towards it and whatnot. But anyways, using, any time checkpoint, whatever you want to make it, whether that be first of the year, whether that be Christmas time, whether that be our birthday. I also am very reflective during my birthday. So doing those important time moments, just take a pause, be intentional in saying, okay, you know what? I want to learn something this year, or I'm going to learn something this month. Make it very achievable, make it very obvious. The book Atomic Habits talks about that, making things very obvious, very easy, and then just putting in the work and making sure habits are sticking. So books, for me, I read a lot of personal development books and business books. Yeah. And so actually are
because you felt pretty, sorry to cut you, but you felt pretty confident in the PT skills and what you could offer somebody.
Yes.
So your grind was something different after.
Right. That's because of the residency and the fellowships that they just, I feel like shoot you forward like 5-10 years. And so I felt confident enough to have a good foundation, greater than school. And I felt like I had somewhat enough information in my mind after 3 years to be somewhat confident in helping 95% of people. And so I was happy with that.
Yeah.
You can always keep learning and going more so I can help 100% of people.
Yeah.
Sometimes I feel like we can't really help everyone because they may not be appropriate for PT. And so
I was going to ask something about that.
Yeah.
If let's say you take someone and they are 100% down to go all the way with PT, what does that look like? Who is that guy? Because it's it's true. Well, I think it's true. You can't help everybody because someone's always going to have something.
Right.
But you can get pretty good at helping most people with a little bit of something.
Absolutely.
So if you take like a guy who's willing to put in all the time, the effort, be intentional, be consistent, have those habits, and you just maximize his learning or his skill development, what does that guy look like in the ortho outpatient PT world?
Well, I think one of my mentors, she's definitely, I feel like there, Claire Frank. She's a physical therapist.
Shout outs.
Shout outs again. Shout out episode. I love shouting out people. It's great.
For sure. I have a book.
Oh yeah.
Yeah.
It's good.
She co-authored the book?
Yeah. With Phil Page's page, I think. Yeah. And so I think it would look like her because she has always been the type, and I've known her for several years now, and she's always been the type to always be improving her clinical reasoning. She's just from, I didn't know her when she was younger, but she seemed like she was always trying to learn something. Every year she had something going on.
Just hungry.
Yeah, really hungry to learn more, to help people. And so I think what that looks like is someone like that, someone who's in a sense dedicated their lives to learning, to teaching, to empowering people, not just patients, but other clinicians. And so you'll kind of go through, and I feel like this happens to a lot of mentors, a lot of people who are deep in the field. They go through these phases of like hungry mode. And so that's like early on, right? And so they're learning. And then once you get to the next phase, which is, let's say, phase 2, then it's more mentoring. And so they're helping other clinicians, right? Yeah. And so that's kind of the second phase. The third phase typically is teaching, like teaching the masses, so she's all three right now. And so she's teaching, she's mentoring, she's still helping patients out, and so I think it looks like that. Other people might have different angles as to how they approach things, but she's kind of the first person that I would say is, hey, she's got a growth mindset. She's willing to sacrifice certain things. She's growing different businesses as well, from an education business. So I was fortunate enough to help out with a few of those classes.
Yeah.
And so, I think it looks like that.
Wow, that's cool.
Yeah.
She's been at your clinic. I don't think I've ever seen her in real life.
Okay.
But videos, man, like continuing ed videos like MedBridge. And those videos with like the bands are everywhere, like connected to every part of your body, and you're doing That's cool, man.
Yeah.
So that's kind of like where my mindset was in terms of asking that question of how do you elevate your game after school?
Yeah.
Because they can only teach you so much. It's only like 3 years.
Yeah.
Yeah.
Mm-hmm.
And they're focused on, they're focused on what they're focused on.
Right.
But can I ask you this, man? Like how come, and I don't really know what they're teaching now. You do for at least a quarter.
Mm-hmm.
Why is it kind of the same?
Good question.
And I would hear that not just from where we went to school, but like across the board. It's like, okay, you're going to learn like the extension for your back, McKenzie, you're going to learn the nerve glides.
Yeah.
But I feel like, isn't there more? Because if you look at Claire Frank, apparently there's more.
There's more. You look at her, there's a lot of other mentors too.
Why is there a lag between what those guys who maximize, like dedicate their life to the craft? Why is there a lag between what they provide and offer and what the school provides? And I'm not dogging on school. Yeah. I understand it has to be done a certain way.
Right.
But it'd be nice to kind of get
up to speed almost with all these things.
Yeah. So why do you think that happened? And is that even true in your opinion?
I think it is true in my opinion. I think most PT schools, from my experience of having PT students underneath me for the last, a decade or so, is going back to what we mentioned at the very beginning is more of it's the fundamentals. PT school is mainly for that. I think it's built to be accredited. I believe you need to, of course, be able to prepare the student to pass boards. And I love that. That's necessary. That's super necessary. Yeah. And so anything beyond that is more money. Anything beyond that is more work, expenses for the faculty.
The stuff that I don't want to do.
Yeah. And so, again, coming from a business standpoint, I see why actually it's hard for things to potentially shift closer and closer towards the current world. Number one, because the information is built to pass boards, typically. Number two, there might be a strong emphasis at the time, whether that be the school, whether that be the faculty members, to focus on certain things. And that's kind of their baby. They want to grow the curriculum in this way, and that's totally fine. And so it takes potentially a committee almost to kind of dissect, which they do. I believe most schools will take time to dissect the curriculum to pick and choose which ones is relevant and which ones are extra and which ones are maybe more clinical. And so, yeah, there's no real perfect answer for that. I would hope in the ideal world of you have PT and then you have these extracurricular classes that people might just have to pay extra for. And so
little add-ons.
Yeah. I guess they have electives. Yeah. Some schools have it. I know Loma Linda has some of those. I know Azusa Pacific has some of those. And so, yeah, I think it just takes time with any institution. Yeah. As whether it be hospital or school, it takes time to make changes. And for whatever reason, why it's slower, let's call it, there's many factors to that. Yeah. And just changing things always takes time.
Yeah. And I won't say they're stuck because at least when I was doing my, what is it? Is it clinical? It's called APHLs?
Yeah, affiliations.
What's the ones before that?
So they call them practicums back then. Yeah.
So I had a practicum. My guy had like 9 clinics and he would just put hot packs and cold packs and just bill for money. This is back in the day.
Right.
And he said, I was like McDonald's out there. People were just coming to McDonald's. Yeah. And I had 9 of them. He got pretty wealthy. But from going from just hot packs and cold packs to like kind of where we are now, like movement science, and like a lot of people are using cameras to get the angles of certain things. There's I don't want to say the schools are that slow. They're making progress. It's just not fast.
Yeah.
And it's multifactorial.
It's multifactorial because if you look at the board's questions itself, again, you're preparing for boards, right? I believe when I was going through taking my boards, it still had the VMO as one of the answers. Yeah. And that's at the time, 2010, I think we've been 5 years removed where VMO may not be the number one answer.
Yeah.
It might be more up the chain, more proximal stability glute, you
Yeah.
know? And so it just takes time for changing that as well.
Yeah.
So it's just like, like pushing this big rock
Yeah.
up a hill, you know? So.
Oh, for sure. The VMO, that's funny because I saw, can I do another shout out?
Yeah, let's do shout out.
Penny Hardaway.
Oh.
I saw when he was doing rehab, there's like a small clip of him.
Mhm.
I don't know what type of injury it was, but bro, they blasted his VMO.
There we go.
VMO. And, that was just kind of what they thought was correct.
Right.
But I'm like, man, my man he would have had a great career.
Yeah, man.
He was giving people work.
Yeah.
Penny Hardaway, man. So the VMO, I don't, there's just a little snippet. I don't know what else they did.
Yeah, right.
But
yeah.
I thought that was funny.
I mean, yeah, again, it's just even in that professional setting, the rehab, the athletic trainers, the physical therapists, the doctors, the sports physicians, the information sometimes, again, this is kind of tying into the current information you may have at the time, maybe just do VMO, quad, may not be up to speed to what the current consensus is, because we might get too busy in our craft.
Mm-hmm.
We might be too busy in our own little bubble of work that we don't look outside the bubble to see what's out there.
Mm-hmm.
And at the end of the day, if I had to choose one word, it would be humility. Humility is huge. And the opposite of that is pride. A lot of times, and I've been there, and I still have pride, I feel like I've learned, I put in a lot of time, I invested to my craft, my approach, that I don't want to change it. And so that's just my personal struggle, is to identify, okay, why is it so hard for me to change my current workflow, my current thought process? Well, it boils down to pride. I put in a lot of work. I feel like, maybe other people may not be as smart as me, whatever thoughts you might have.
Mm-hmm.
So you have to dispel that. I had to dispel that and say, hey, again, we're all on the same team here. We're all trying to get better. Let's try to take what's good from what they're saying and apply it to myself and grow. And so for me, that's a life journey that continues to grow. And, whether you're a spiritual being or not, that's kind of also part of that, is to grow.
I'm going to give you alley-oop. We went to a continuing ed course.
Mm-hmm.
It was a 2-day course. I went to both days. You went to 1 day, and I feel like you still learned more than me.
No, but
yeah, it's funny. No, but after that, because I know your foundational training, and I'd like to say I know kind of what they teach and like their direction and approach, and I kind of asked you to compare what you learned there.
Yeah,
and I was asking it from a place of just kind of like trolling, like making fun, like, oh, what he's going to say.
Sure.
But what was memorable about that was you kind of dissected it as like you accepted everything as like true, as if it would be true. And I felt like you were taking the good in it and you were applying it to the practice, and you kind of just had positive, opinions on both things.
Right.
Then a couple of days later, you put something on your page. It's like kind of like techniques that you learned.
Yeah.
And I was like, man, this guy's flexible. This guy's like, and I love the humility part, because some people, it might, like Great Wall of China concept, it might kind of keep the good stuff out too, even though you're trying to keep the good stuff in.
Yeah.
Yeah. I don't know if I messed that up.
Yeah, that's okay.
But yeah, that was cool, man.
Yeah. And so, no, I love that because, I could easily say, okay, well, I've got
trash.
my business. That's trash. I've learned so much already.
The research says that.
Yeah, exactly.
I get you.
But at the end of the day, as I literally wake up every morning, I ask myself, how can I do better today? What can I do to help other people do better today? It's not so much about me. It's about how can I improve myself to help someone else? And I feel like that perspective in life is very important, because that's in my opinion, how to continue to grow.
Yeah.
To be less self-centered and to be more other-centered.
Yeah. So whatever you're doing, man, keep on cooking.
Hey, man,
keep on
trying
cooking,
to cook. To learn how to cook.
I want to, just before I forget, you mentioned you're in a kind of like hospital setting. Was it the hospital or medical? Sorry.
Yeah.
And you felt like there were some limiting factors or inhibiting factors, kind of like chains on you or whatever you want to, however you want to say it.
The golden handcuffs.
Yeah. You wanted to do something, but you couldn't. What was that? Can you define kind of what that was?
Sure, absolutely. And so what that was use of equipment, use of space, and use of time. And to elaborate on that is when you have an athlete or an active person, you need to spend at least 20 to 30 minutes or more on that session. 20 minutes may not be enough. And so you might need an hour. And so when you're in a hospital system or in a more rigid system, you might only have 30 minutes or 45 minutes max.
Gotcha. So it's
and
time.
So it was a time.
Time is one.
Time is one. Number two is equipment. Equipment is key to developing power, to accelerating healing, to grow muscles faster. And so in those more rigid systems, let's call them, there's not a budget for these technologies. There's always going to be, why do you need this? Okay, show the studies,
Just get the job done.
Get, for them, it makes sense, is what can I do with the least amount to be cost effective, but still produce enough and make money too. And so it's because they call it probably bells and whistles, extra things.
Yeah.
And so
the cool stuff.
And so when you break down, this is probably a whole nother thing, but when you break down the science of the insurance practice, there's actually a pretty interesting point with that, but I'm going to say that for another time. Yeah. And so
thank you, insurance.
Exactly. Yeah, I know, right? It is what it is. But the equipment is key to developing an athlete to be more resilient.
Yeah.
Let's say you have a table and bands, but they need to jump, cut, run. So you need equipment, you need weights to load them up. Running is 2 or 3 times your body weight. So you need to load it up at least 2 times your body weight.
Yeah. And
so, but if you have bands, you're not going to be able to load it up. And so equipment was key.
Is the yellow, green, blue.
Yellow, green, blue. Exactly. Okay. And you need probably black, or something else.
Double.
Yeah, exactly.
I get you, bro.
Yeah. And then lastly, it's a space, being able to move, maneuver. I remember being in the hospital setting, and I had an ACL client, and I had just learned all these cool drills from the sports fellowship. I'm like, I'm going to do a T-test.
Yeah.
A T-test is like 10 yards, 5 yards.
Yeah.
And so I went to the gym, and there were many therapists around me. And so I had to put cones.
How am I going to do this?
Exactly.
Parking lot.
Yeah, I could have done that. I think there's like a liability thing over that. Get hit by a car.
Oh, shoot.
Yeah, no. Jump over the car. No, I'm just kidding. So I just remember being limited in my space. I would ask them, okay, cut there. And then like someone walks by. Okay, start over. And so those 3 factors are the main drivers as to why I wanted to start my own practice. Because I didn't feel like at the current time there were any clinics or locations that made sense for me to practice the way that I felt was ideal for an active person.
I love it because, excuse me, you took those problems and you made your own solution.
Yeah.
IPIM, shout out.
That's right. Shout out
to you, my dog.
Thank you.
And the team.
Yes, that's right.
Yeah, I love that, man. I definitely can see that as a limiting factor. Yeah. But again, I can also see how it's a business and they just want to provide. They still want to provide people with help, but they got to make money too. I understand all that.
Yeah.
I want to talk about now because we're saying like research and science a lot. I'm just going to give a little pushback. I understand how they make methodology and how they can create all these like research articles. Now, and what kind of makes me jaded is because I worked with someone who was, and shout outs, but I worked with someone who was like, no, the research says this, so we do this, the research says that. And it's kind of like a more rigid approach, so to speak.
Right.
And then in my head, I'm like, okay, I understand there's the people who research and develop like new techniques and this and that, and they have data. But PT is not an exact science.
It's not.
And here's what I'll compare it to. You have chemistry, right? You have certain compounds and you mix them together. You're going to have the same result. 10 out of 10, 25 out of 25, 100 out of, but let's say someone has knee pain. They come and you work out with them. You give them the best plan of care based on the research available. And let's say you have 10 of those dudes or female, people.
Yeah, clients.
Some of them are going to get better. Some of them aren't. Some people are going to come in with an MRI that says bulging disc with no pain. Some of them are going to come in MRI's clean, pain. So I'm thinking, okay, where's the exactness in the research? How much can I trust this other than like looking at each one? No one has time, at least me, I don't have time to look at every single one and see exactly what they did to get the true results. But we have time to just see the short snippets. Oh, okay. Yeah, we do this. We do that for that. But why is it the case that I can't get 10 out of 10 positive results with research?
That's a good question. No, I love that question. I think as with anything, it's, when someone asks you a question, it depends. It's kind of one of those situations where there's just so many factors to it, and there needs to be more, I guess, introspection with that. My humble opinion is that research is a way to prove the scientific method, but there are many agendas, there are many angles as to who and whom will be sponsoring the research. And so,
can you give me an easy example, a real life example?
Sure.
Yeah.
Oh, me.
Yeah.
Okay. And so I don't have any specific examples. These are more just like, I guess, controversial things,
I get you.
With that aside, like the true evidence-based practice, right? The reason why I think it's so hard to provide an intervention and get 10 out of 10 exact same results is because the human body is so complex. The pain problem that we have is so complex. We have, just like the Stone Ages, we start with this small idea or understanding of something. Then we develop into, the Bronze Age, then we develop into the medieval age and whatever, and it keeps kind of going up. And so same thing with research. As we first start with an idea or a problem, people will start researching it. But then more people who are also smart will kind of dissect it and kind of fight and push back and take sides and whatnot. And so I guess to answer your question, it's because it's very complex. The interventions that we do, we still honestly don't exactly know what happens because everything is in the brain. Everything is physiology. And the mind is such a powerful mechanism, a powerful motor and thing that I might tell you, hey, just go eat peanut butter. And I think it's going to help with your shoulder pain.
Sweet.
Yeah. And then you go eat it and literally.
And it helps.
Because the brain has a medicine cabinet and it'll unlock the placebo effect and actually help you with the pain. So whatever we believe in actually can make a change. There's a lot of studies even of people who, this is kind of an extreme version, where a study, I believe, took a sample size of people that told them that something will give them hair loss. And it actually was not directly causing hair loss, but they started losing hair.
Whoa.
So
I love those. Yeah.
Isn't that crazy?
Yeah.
So anyways, to answer your question again, it's just the power of the mind and the brain and the preconceived ideas of the person becoming the recipient of the intervention. It's hard to quantify that. You know?
Yeah.
The part of our study, in a sense, during my fellowship was lower quarter. And my mentor didn't want to do upper quarter because it's super hard to quantify the shoulder, quantify the shoulder blade. And so a lot of that happens in research. A lot of the times, how do you quantify someone's feeling? Is it a chemical, like you said, chemistry, or is it a neural pathway that you can't really measure right now?
Yeah.
The exact pathway.
And even today, how do you measure pain? Is 0 to 10 scale or
it's very archaic.
Yeah. Okay.
That's why you have those patients. Remember, it's like, how's your pain today? 20. No, out of 10. Yeah, it's 20.
I said 20.
Yeah, exactly. Yeah. Or a million. Yeah. It's like, okay, not really.
I can't move.
Yeah, exactly.
Yeah, man.
And so the complexity of our bodies make it hard for us to pin it down, have a data point, and go from there. because that's not our human experience. Our human experience is much more than data points.
Yeah.
It's so complex.
Yeah. And I'll just kind of like put that in as an example. So let's say we have someone with knee pain
Mm-hmm.
and you see that their knee is a certain angle where it even by looking at it, it looks painful.
Mm-hmm.
But they're fine.
Yeah.
Right.
Mm-hmm.
So if you look at it from a biomechanics standpoint,
Mm-hmm.
oh, I want to straighten that knee out.
Right.
I want it straight over this toe or whatever. I want it here when you bend. I want it like this. And technically, things should be pain free. But let's say for a person that does have the pain,
Mm-hmm.
and you line them up, everything's good to go. Still hurts, Pete. Still
Yeah.
hurts, man.
Mm-hmm.
Where's the peanut butter?
We need that peanut butter.
Yeah.
PT peanut butter.
But do you feel like, pain is tough.
It is.
What else can we provide in terms of treating pain if biomechanics it really won't help them?
Yeah.
Or have you seen that?
Well, you look at the hip hop dancers,
Okay.
they have to do the move where their knees go inward to do a move.
Mm-hmm.
Or goalies in hockey,
Mhm.
they literally have to do that really fast,
Mm-hmm.
drop their knees and literally sit in like a W sit.
Mm-hmm.
And they seem to be fine. There's a lot of hip hop dancers who are okay.
Yeah.
So it all comes back to what do they need at the time? And what is the patient's understanding of the problem? And our understanding as providers as to what is going on. Where is this tissue in this continuum of healing? For example, someone has a medial knee pain, their knees go in, and maybe back 20 years ago, all they did was VMO and they got better, but their knees still went in, right?
Right. Okay.
And that's a classic example of go to the future, which is now. Knees go in, we do glutes, and they get better as well. And so, again, it's I guess the idea that we have to understand what's going on. I just was thinking the other day about my students and how can I simplify a self-reflection. And so I came up with they should, before every patient, you should ask these 3 main questions.
Oh, it's going to be juicy.
It's going to be juicy. Well, it could be very simple, but it's what? It's simple. What? What's going on? What's the tissue source? What do I think is literally going on? Because a lot of times we go through and see patients, we just go through the motions. We don't really know what's going on. We're just following what the previous provider did, doing what I thought it was initially, but it actually wasn't the right, diagnosis in a sense. So the first question I try to ask myself and I try to train my students to say is what? What's going on? What's the tissue source? What's going on? Number 2 is where. So where are they in the plan? Where are they in the tissue healing? For example, if I just went out and just kicked the door, my knee it would hurt. And so anything I did now with glutes or core will not help my knee. It hurts because I just banged it. It's an inflammation process, right?
Yeah.
And so we have to understand where. Where are they in this timeline of healing? Where are they in their goals as well? That's important. And then the third question is how. So now I know what, I know where. How am I going to get them to the end goal? How am I going to get them back to running? How am I going to get them back to MMA? And so I guess those 3 questions help me try to stay on top of, the reasoning behind things and to be clear into what I'm going to do for my patients. And so I think as long as we have that, you can do VMO, you can do glutes, and I think you will have the same results, honestly, if you take into consideration those aspects and understand that the brain of the recipient, of the client or the patient, needs to be understood as well.
I'm going to find those research articles for the VMO, uncover them, bro.
Let's bring it back.
Dusted them off.
Well, there's
Put them back.
shout out knees over toe guy.
Right. I heard that.
Right?
Yeah.
And I don't know if he's helping a lot of people, but there's a lot of good evidence to suggest that his clients are jumping higher and are more resilient in their knees.
I think I could be wrong, but I think his thing was when the research at the time that studied the VMO, it only studied the contraction of the VMO at a certain range. But you notice his videos, he goes all the way down.
Full range.
Like
sissy squat. Knee to the ground.
And so that's the kind of like the undiscovered. I don't know. I could be wrong. That's just kind of in passing. I saw that somewhere.
Yeah. And so when I saw that, because a lot of students ask me, hey, what do you think about knees over toes guy? And we're just talking about going back to the concept of research and current practice, right? And so, and being open enough to understand what's good about that. And so for me,
I love that callback, bro.
Right? Exactly. Exactly. And so when I look at that, I'm like, that's a great way to build quad strength. Okay, good. Check. Awesome. But what's your goal? Are you trying to jump higher? Okay, well, the studies do show that the quads and the tendon, elasticity of the tendon accounts for a lot of the vertical force. And so when you're trying to jump higher, yeah, knees over toes is actually a good way to load the muscle, the quad. It's a great way to load the tendons as well if you're having tendinopathies. The only issue is if you already have strong quads and you have a inflamed tendon and you keep doing that, that's going to cause issues. This is kind of a side point, but there's a story of, and I don't know if there's a direct correlation, but this is what happened. One of my mutual friends started the program. And again, I'm not trying to knock on the program, the Knees Over Toes program. But I think months later, he actually developed pretty bad tendon issues. And don't quote me on this, but I think he might have needed surgery for one of the tendons, that it got overloaded. And so it's all about balance, and then it's all about intentionality. Are you trying to improve your tendon health? Okay, are you doing something in your 7-day week to overload the tendon? Then don't overload it more. But if you're not overloading it, load it up.
Right.
If you're working out constantly, you may not want to do this program.
You kind of want to identify where you're at.
Exactly.
That's too much work, man. I don't want to do that.
Right? It is a lot of work. Yeah.
I just want to do the program and get better.
That's what most people want to do. It's like, man, and that's the problem with going with just a program that's not customized to you specifically, is it will work for most people, but it might not work for you, and it might actually injure you potentially.
But assuming he's coming from a place where he really wants to help people, and some people are yamming now, doing windmills.
And he highlights those people.
Yeah.
Yeah. And so I want to yam too.
Yeah, for sure. I'm going to get that. I get on that program,
right.
man.
There we go. But it does come to individuality, and it comes down to customizing a program. If you're truly aware of your intentions, like, I want to jump higher, I want to be more resilient, it's somewhat, I would feel, unsafe to choose a program without consulting an expert. So I'm a big pusher on whatever your problem is, go talk to an expert. If you are dealing with mental issues, go talk to an expert. If you're dealing with body issues, go talk to an expert. And so the reason why they're experts and licensed is because they put work in, and they tend to know and can help you the fastest. They're there to accelerate your recovery, mental, physical, whatever it is. And so anyways, yeah, it's a whole nother concept, but I think it's important.
I like it because it still can be a positive, man. If you're in that time frame or where you're at, if you're ready for it, it's going to be good for you. Love it, man.
Yeah.
I had a question on, let's say, I want to go back to the burnout, man. You asked those 3 questions, like, what is it? Can I just give an example, like a small everyday example that everyone as a PT will see? Low back pain. What is it? It's low back pain. Okay. And then you said, where, right?
Yeah. Like, where are they in the timeline? Is
chronic.
Yeah.
I have had
over 3
back
months
pain for 12 years, man. It stopped me from doing all of this. And then
where are they at in their goals as well?
Lost.
Yeah.
Honestly.
Yeah.
Like, I cannot do anything. I can't do anything, man. I can't even get on that bike. I just want the heat pack, please. Today is just the heat pack day.
Yep.
What do you do with that?
Right. And so the next question is how? Like, how do I get them back to, they're lost. They believe that the hot pack will help them, which it can, because they believe it. And physiologically too, the heat can help, of course, improve circulation, which then circulates to the nerve endings or the muscles or the tissues that are inflamed, and can reduce pain potentially too. And so how do you help that patient that is in chronic pain mode? They've tried everything,
Yes.
they're lost, and they approach me for help. And so there's a whole...
By the way,
yeah.
bro, they're only there to see you so they can get their pain meds after the 12 sessions or whatever. You know what I mean? You know what I'm talking about?
I know. I've been there too. And so this scenario can go many ways. For me personally, I kind of nip it in the butt really early, and I'll say, hey, I have a feeling that you're just here to complete these 6 to 12 visits. So
Honesty.
You can get your medication or get your surgery done. Is that true? And they'll probably say, yeah, you're right. I'm just here to do this. And it's usually probably a workers' comp case, you know? And so I try to negotiate with them. I'll say, hey, this is what my specialty is. This is what I can do for you. But it's a two-way street. This is what you need to do for me as well. And it takes compliance, because just as you're here, this is like your work. You're not currently working, but you are working to get back to work.
This is our house now.
This is our house. Send me to my house. Protect this house. And so having clear expectations from day one is important. And I've had those patients who say, no, you can't help me. PT sucks. This doesn't work. And yeah, I need my 6 sessions, bro. Like, sign me off type of thing, you know?
Yeah.
And on some occasions, if I truly feel like they do need those medications, or they do need that injection or that surgery, I'll say, okay, how about I do this for you? I'll say, let's make a commitment. I'll say, hey, these are 6 sessions. I expect you to at least try, because just like you clocked in for work, I need you to try these things I'm going to give you. Is that fair? And so those moments, those experiences where they actually tried, but they never got better, good. I can actually write in my assessment, they tried, we did this, and it didn't work. Perfect story. You're set up, slam dunk, go for it.
Yeah.
But if I write in there, and
I'll see you in 2 months.
Exactly right. After surgery. But if I write in there, patient was non-compliant, you can actually somewhat, that non-compliance can actually block you from getting what you want. And so it's almost like, again, you have to negotiate and almost dangle the carrots, find out their motivation. As 12 years in now, I love the aspect of psychology and habits, it's as huge, I mentioned, right? Man. Yeah. It's massive. And so if I ever had to do a PhD or, go back to school to study, I would love to study that. The psychology, the brain, chemistry, and the power of habits, and how we can help our patients better.
Habits are huge, man.
Yeah. Yeah. Because it's a lifestyle. People are usually in pain because unfortunately, their physical habits, dietary habits, nutritional habits, their mental habits have actually, unfortunately, put them into those positions. The good news is you can come out of it, but it takes a lot of work and awareness in that.
That's super interesting.
Yeah.
One day, let's work out just pain, like an episode just on pain.
Yeah.
It's so complex, and I don't want to just shortchange it.
Yeah, right.
Because I know to set the table for that will take some time.
Absolutely.
But I'll save that for, I wanted to go in there, but I feel like we really need to take time for that.
Yeah.
Plus, I could ask you questions for days. Man.
Oh, man. And I may not have the answers for all that. But I do have a friend that... Do I? I do have a friend that is pretty well versed in the pain science world. And so maybe we can have him on board as well. That'd be fun.
That'd be awesome.
Yeah.
Just kind of to land the plane, wanted to ask you about just a couple, like what people would ask normal, I like as a friend in casual talk, because it's kind of challenging when you're like, it's almost like a joke. Just like, oh man, my elbow hurts. Like, what should I do?
Oh yeah.
But I feel like you never, in that setting, you never have enough time to really like explain what's going on.
Right.
So it's just like, oh, just do the eccentrics, just load it, or just do this, do that. Kind of how do you deal with that? What's a good way to, other than, I know, because I asked this to a lot of different people, they're like, let's set something up, man. Let's set something up. Then
other than that,
promote yourself.
Yeah.
Set them up a little bit better.
Right. It's like, hey, text me. Let's set you up for an appointment. Right. So that's obviously one angle. And like you said, For me personally, a lot of people know that I'm a physical therapist,
Mhm.
and a lot of people know, and I also enjoy it. Know that I enjoy helping them, and so as a young clinician, I would do maybe a 5-minute eval and then like a 2-minute treat.
Mm.
So it'd be like a sampler. I would give them a very short sampler.
Denny's, we had Denny's.
That's right. McDonald's or Denny's. Yeah. And so that's kind of how I would do it. I would preface it very strongly saying, this is just a generic recommendation.
Mm.
It may or may not help, but this is what commonly helps a person that has your problem. And so I would either email them like almost like a cookie cutter exercise sheet.
Yeah. Yeah.
And so I would kind of do that. I would either text them or email them, hey, this is what I would maybe do, but if it doesn't get better, come see me, or go talk to an actual physical therapist and get official sessions,
Mhm.
And so, yeah, and I think it happens a lot, and I've navigated through it differently depending on how much energy I had that day, how tired I was,
How much time
I have, and whatnot. So yeah,
cool, man. Who's gonna win the NBA championship this year?
I mean, you already know the Golden State Warriors.
That'd be funny, man.
You never know. You never know.
Yeah, you never know.
This year's wide open.
Yeah, that is true.
There's a lot of good teams. East,
it's more
teams
evened out.
Yeah,
it's more evened
it has. It's kind of weird, but it has.
Man, I honestly could ask you a lot of questions, but just one last one.
Mm-hmm.
James Harden's shooting form. One leg internally rotates, it caves in.
Klay Thompson actually has that issue as well.
Yeah.
It's not as bad.
Not as bad.
James Harden has his knees that go in as well.
My man. But he's cooking people with step backs, whatever.
Mm-hmm.
What would you change that, or is it really just because I'm thinking he's making millions of dollars getting buckets?
Yep.
Don't change it,
dude.
But how do you?
Yeah.
What do you think? Just curious.
A lot of people ask me that same question too. Dirk, his knees went inward. Kobe's knees went inward.
Mm-hmm.
Kevin Durant, knees go inward.
AD when he lands.
Yep, that's why he's made of glass.
Oh man, it's just like
Yeah, no. So for me, it kind of honestly goes back to that same chronic pain patient because it's all about what do they want? Do they want to continue their current movement habits and make millions? True, but there's a big but.
There's a trick.
Be able to walk with their knees angled in when they're 50.
Kenny the Jet Smith.
Yes.
Yeah.
Classic example. He's probably the most famous person on TV that has knock knees.
Mm-hmm.
And when you see him run to the big screen, his knees are kissing each other.
Like a penguin.
Unfortunately, like a penguin.
Yeah.
And so that creates issues up and down the chain. Affects your low back, affects your foot, your toes, your neck, your eyesight. It literally can affect everything if your alignment is off, quote unquote off.
Mm-hmm.
And so to that person, the James Hardens of the world, to the KDs of the world, if I had the opportunity to treat them, I would say, hey, you're killing it. You're doing really good.
See me in 10 years,
but
5 years.
If you keep moving that way, you're going to be, you might need a replacement in that knee. And you might need to be aware that you will have problems in the future. And if you're okay with that, no problem. You know, at the end of the day, I think part of the anxiety as an early physical therapist or medical provider is you want to help people so much that you almost impose your own will into their own decisions. But that's not our job. Our job is to be and provide the best care. And it's their job to choose if they want to follow the plan or not. And so it's up to James Harden to choose if he wants to change his mechanics or not. I've had many stories where I've helped basketball players change their knee form and they became faster. Their shooting form got even better. Their percentage got even better. They didn't feel as painful in their back or their knees. So there's, in my opinion, a lot more positives in becoming more efficient biomechanically than choosing poor biomechanics, being injury prone, and making millions. You can probably make more money if you invest. Like LeBron. LeBron's mechanics are effortless. They're just perfect, close to perfect. He's 38. His knees don't go in. He lands with pretty good shock absorption.
Yeah.
You look at him and it's amazing.
I remember shouts to Alan Lee. Because we go back and forth sometimes with sending photos.
Mm-hmm.
He just showed me like perfect rib cage mobility and like posture when this guy's like bringing it back.
Mm-hmm.
And he's just explaining to me like, this guy is the dude.
Yeah.
And he's still playing.
He's still playing.
But I love looking at that stuff, man.
Yeah.
And I love your point, man.
Yeah.
It's just kind of at the end of the day, the person's choice.
Mm-hmm.
And just kind of provide what you can provide.
Yeah.
My
That's
man, yeah, we have to do that pain, man. I mean, I'll go to you or whatever, but I feel like it's just so interesting because at the end of the day, everybody has pain.
Yeah.
And I'm sorry we didn't get to it, but man, I will represent everybody that's interested in pain just to pick your brain.
Yeah.
One more time.
Hey, we'll do a part 2 or
for sure, man.
part 5.
Dog, thank you so much.
Of course, man.
Woo!
Woo! Hands gold.
Yes, sir. Oh, mine too. All right, man.
All
Thank
right.
you, bro.
Good
Peace.
stuff. Thank you.